Hello everybody, my name is Maria Gearan and I'm the Mesothelioma Clinical Nurse Specialist for Merseyside and Cheshire region. Many of you will be familiar with the series of interviews and podcasts we've been doing over the last 6 months or so with an attempt to keep everybody up to date and focused on the developments within the mesothelioma circle. I'm very, very pleased today to be joined by Sandra Kellett. Sandra was diagnosed with mesothelioma back in 2017, and she's very kindly agreed to speak to us today. Sandra, I have to say, is one of our go-to people, certainly in the Merseyside and Cheshire region. She's always first to put her hand up, hence that she's here doing the interviews today, to help in any way. She's taken part, being a great asset as a patient representative with the Mesothelioma Passport Information Booklet. She's taken part in the MORE survey, and she's also been instrumental to contributing to the most recent MAGS report. Sandra, we're very pleased to have you on board today. Thank you very much for joining us.
Nice to be with you.
And I know that you're always, I have to say that as part of the Living Well group, you're one of the go-to people for not only the members, but the carers and the people involved in that group. So before we go any further, I'd like to thank you for that.
Thank you.
How are you?
Yeah, I'm okay. I might have to refer to some notes, and I apologise now for coughing, but it's part and parcel of the meso, so I apologise if I have to have a drink or something.
Don't worry, if you need to have a drink or if you need to stop, just let me know, Sandra. Okay. So as I said in the introduction, you were diagnosed back in 2017, and that was after a grueling 2 years of treatment for a lymphoma. Is that correct?
That's right, yeah. I was diagnosed with non-Hodgkin's lymphoma in May 2015. I went on to have 6 months of chemo, which put it into remission. But then I was put on maintenance rituximab, which is one of the chemo agents, just to keep it at bay, basically. Unfortunately, that didn't go to plan because I then developed a hacking cough, which was relentless day and night. It was horrendous, really. I also became really breathless with minimal exertion and lost my appetite and lost weight. I literally dropped 6 stress sizes in about 3 months. At the time, I continually asked my consultant, the haematologist, if it could be due to the rituximab, and was constantly told no, it couldn't be that, because I'd had that as part of my main treatment. And I tried every medicine under the sun to help with the coughing. Didn't help. Went to see my GP. One of my GPs actually said to me that I should go home and concentrate on not coughing. I came out of her office absolutely devastated, thinking she thinks it's all in my head. It was just an horrendous time. I really felt that I wasn't going to make it.
So you eventually were seen by a chest physician, I know, and referred across to the surgical team where you had a FATS procedure, and that's where you were given the diagnosis. Is that correct?
Yeah. I went on to steroids for 12 months. I was diagnosed with acute pneumonitis because of the rituximab and went on to steroids for 12 months. And towards the end of the steroid treatment, which had been brilliant in resolving the pneumonitis symptoms, I started getting breathless again. So when I saw the chest physician in August 2017, she noticed how breathless I was and sent me for a chest x-ray. From there, I went for a CT scan and then saw her again and was referred for a VATS procedure. And then went back to see her a week after and was told the devastating news that it had come back, that I'd got mesothelioma.
And how did that make you feel, Sandra? Had you heard of mesothelioma? What was going through your mind at that time after going through one type of cancer? Here you were sitting there listening that you've got another.
Yeah. Obviously, I was devastated. There was me thinking, okay, I've had one cancer plus side effects and I've got over it and I've beat it. And then to be told that. I should point out here that I've been a nurse for 44 years and I've been a nurse clinician for the last 15 years, having done a full master's degree in clinical nursing. I knew exactly, unlike most patients who are told they've got meso, I knew exactly what mesothelioma was, because I'd cared for patients with mesothelioma during the placement. So I knew what it was, and my whole world was just blown apart. I can remember looking at my husband and saying to him, mesothelioma, the worst diagnosis they could give me. So yeah, I was devastated.
And were you aware at that stage, or did it come into your mind at all where you'd had your exposure? Because I know you said that you'd been nursing. Did that come into your mind at all?
I didn't. The consultant, that was one of the questions she asked me after she told me what I got, was if I knew where I could have been exposed to the asbestos. And to be honest, there and then, I had so much going through my head at the time, I just couldn't even think about that. But I kept thinking, well, I've not been, they've got this wrong. My initial reaction was, they've got this wrong. I've never been exposed to asbestos. I'd worked my whole life in the NHS and didn't realise that you could get it in NHS hospitals. But that was where they found out that I'd got it. The hospital I started my training at in 1975 was apparently an old workhouse that was full of asbestos, and we never got warned when we were doing our training. And that's where they believe I contracted the asbestos.
And sadly, to this day, we know that it is quite common for healthcare workers. You took part, as I alluded to earlier, into the MAGS report that we're trying to raise awareness of exposure in healthcare workers. So it's a really important point there that you say you weren't really aware that that was a possibility at all.
It's devastating. As a nurse, I'm so passionate about nursing. The hardest thing for me about all this has been having to give up nursing because I wanted to carry on working. And it's something I still love and I'm passionate about. And to think that this is where I caught this and it's going to kill me. The injustice of that is just horrendous. It's really hard to get your head around that.
So once you'd sort of spoken to your family and you'd started thinking about treatment options, what was the next plan after your diagnosis?
After I was diagnosed, I was referred to oncology. Again, that was because I know what an oncologist is. And like I thought, oh God, this is really end stage now. So I was referred to an oncologist that I saw pretty quickly, really. And from there, he said to me that it was difficult with me because I'd had the lymphoma and it was only 2 years before. And because I'd had pneumonitis and now I'd got the meso, that they weren't sure what kind of treatment plan they could offer me. So he spoke to his colleagues and it was decided that I would commence, well, they asked me if I would go on to the mouse 2 trial, which I did. I went on to the mouse 2 trial and I had 2 rounds of chemo. Now, let me just say, the chemo from the lymphoma was a breeze. Honestly, apart from hair loss, I was quite well. I was out and about, no side effects really. The chemo for the meso absolutely was brutal and completely floored me. I'd spend 18 days of the 21 days in bed because I literally just couldn't move. So I'd already got, I know they say to people, don't research things and don't look things up when you've been diagnosed, but I needed to do that. That was something I needed to do for me. Maybe that's a nurse in me, but maybe it's just me. But I needed to know. Some people don't want to know that. Some people are happy to just go along and be guided about and advised what to do. But I needed to know. So I looked up loads of things. And I'd already got it into my head that surgery was going to be my best option. And I was really, really sure that that was what I wanted to do. I wanted to go down the surgery route. So the mouse 2 trial looks at chemo versus chemo and surgery. And after 2 rounds, you're randomised. Now, I know all about randomisation as well. So I knew it was a 50-50 chance that I'd get randomised. But I got it into my head that that was going to be my best option. And I was absolutely devastated when I didn't get randomised to the surgery. So absolutely, totally devastated. I came home after hearing the news and absolutely broke my heart because that was what I wanted. That was what I believed was going to help me. Looking back now, I'm glad I didn't have the surgery. At the time, that was the only hope I could see, at the time. But, I didn't get the surgery. And I went on to have another 2 rounds of the chemo. Unfortunately, I had to stop after those 2 rounds because I was just too toxic on it. I couldn't tolerate anymore.
And so you had to stop. So were you just given a break, a period of time then, just to get over things?
My oncologist decided then they would leave me and not give me any treatment. And I would have scans every 3 months just to see how things were going. That in itself is anxious because you're not on anything. You've got a cancer inside you that you know is a fatal cancer. And so that was quite hard, really. You lie in bed, and I used to lie awake. I'm not an anxious person, but I used to lie awake worrying about where the cancer was going and what was happening. But at the same time, I got 18 months of stability, which was brilliant. I got on with, I thought to myself, right, okay, I know I've got this incurable cancer, but I'm going to get on with my life now. And we did. My family and I went out, we did loads of fundraising for Meso UK and for MAVS. I got involved with lots of research and things. I thought, I'm not going to let this cancer define who I am. And so that's how I coped with it. And I had the 18 months of stability. And then unfortunately, after my scan, it showed that the meso had started growing again. So from there, I was then referred on to my current consultant for immunotherapy privately.
And did you have some immunotherapy?
I did. I went on and I had the 4 rounds of immunotherapy. And immunotherapy, there's so much hype about the immunotherapy and so much good research about it and how good it is, but it doesn't work for everybody. And unfortunately, I was in one of the probably minority that it didn't work for, which again was another body blow because I'd heard so much about this immunotherapy and I'd built myself up again thinking, okay, this is going to be my salvation. This is going to be the thing that really helps me. And again, I was floored again because after the 4 rounds, I had a CT scan and my consultant rang me the day before to forewarn me that it wasn't good news. And it had actually shown that my meso, not only had it grown in the pleura, but I had now had widespread lymphatic metastases across the whole of my chest. So that was a blow.
And I know that you had a difficult conversation with your consultant at that time, didn't you? You had a brave but difficult conversation.
I did, because like I say, I'm a person who needs to know. I'm not one who thinks that other people know something about me that I don't know. So I asked him outright how long he thought I'd have left to live. And he was quite front. I know they can't tell you and give you definitive dates, but he did say to me that he thought I had 6 months, and that was beginning of October last year. My next question was to him, so what else? Is there anything else we can do? Where do we go from here? And he advised me that there was a couple of other options. They were, again, private drugs, but I was fortunate enough I'd already won my compensation claim, so I knew the funding of it wasn't going to be a problem. But he said they weren't a cure, but they could give me more time. Well, when you've told you've 6 months left to live, you cling on to any time that you're going to get. I was only 60 at the time. I wasn't ready to leave my family and friends. I'd still got a lot of living that I wanted to do. So there's no way I was going to just go anywhere without a fight. So I said, right, when do we start? And he did start me. I mean, it took a battle getting the defendants to agree to the treatment because it was expensive, but we got the treatment and I started on the treatment, which was a combination of 3 chemos. Again, that wasn't without its problems because even though my cancer seems to be chemo sensitive, I don't handle the chemo very well. And I did have side effects like bleeding and a pulmonary embolus and sepsis on a couple of occasions.
Yes. So you've certainly struggled through your treatment. So that was last October, 12 months ago, and you were coping with your treatment. And then who would have thought it, along comes COVID-19 and we're hitting a pandemic. So suddenly when you're wanting to spend the time with your family, like you've said before, you're suddenly told that you have to shield. How was that? How did that affect you?
That was horrendous, really. I'd literally started shielding 2 weeks before the actual official date for shielding, because I remember being out somewhere with my husband, and because my cough was so pronounced and because the media was so hyped up on COVID, I could literally see people moving away from me. And I thought to myself, oh, I'm not going out. So I actually started the shielding early. But that was horrendous, because it wasn't just all the media hype, about patients with chronic lung conditions or terminal lung conditions like I had, not getting ICU beds or ventilators. But also, as they came out asking about us signing do not resuscitate forms. And it was just an horrendous time. I know everybody's gone through an horrendous time, and I know we're not just the only group of cancer patients to suffer, but it was an horrendous time. I had a conversation with my consultant about my treatment, and he was more than willing to carry on with my treatment, but he did say to me, he said, my only concern with you, as I'd just said, I'd had a couple of episodes of sepsis and bleeding with this, and what he was worried about was that I'd end up in A&E, which is where and neither of us wanted me to be with the COVID rife. So we jointly agreed that we would suspend my treatment. That didn't take away all the anxieties, I'd agreed to it. Against my family was aghast, really. They were really upset that I wasn't having my treatment. And no matter of how many times I tried to say to them, it's for the best, they still didn't believe me.
Sure,
and I was still concerned about what was going on with the cancer. But, I had about 8 weeks off the treatment. And if anything, it was a relief, really. It gave my body a chance to get back, to some kind of normal before, we tried it again.
So then you slowly started to go back to the hospital, having a scan and going back for your treatment. And how was that initially? I mean, the hospitals they were back to normal. We're seeing some changes again now. But initially, when you first went out, how was that in the hospital? That must have been frightening after being so cocooned for so long.
Yeah, it was really frightening and really surreal. Even just setting foot outside of your front door when you've been shielding, because the last thing I wanted was to catch this virus. My biggest fear was that I'd catch this virus, be taken away from here, not be able to see any of my family, be put on a corridor and not given any kind of interventions, die and be cremated en masse with nobody. That was my biggest nightmare. And so I was terrified. So even walking outside your front door and straight into the car on the drive was scary enough. And then you got to the hospital, and it was surreal. I had to go to the hospital a couple of times whilst I was shielding, because I had problems with the PICC line. And it was just surreal. It was like being in a sci-fi film, like there was just the odd person you'd see with a mask on, and everybody was like clinging to the sides of the walls, walking past one another, and nobody spoke, or you couldn't see if they were smiling. It was just a weird sense,
totally different from the usual hustle and bustle of
totally.
So here we are, 12 months on from, over 12 months from that very brave conversation that you had with your consultant, and you say you're doing well at the moment. You're struggling with your cough. I know that troubles you, but you've had chemo this week and you're coping reasonably well with any side effects, are you, at the moment?
I am. Well, here we are, like October, I was told I had 6 months, and here we are over 12 months, and I'm still here, and I'm still doing really well. I get breathless. Yeah, I get the cough's a nightmare. But apart from that, I'm doing quite well, really. When we can go out, I can get out and about. So I'm doing, I feel blessed, really, every day, because I've lost quite a few friends during this pandemic, and a few friends and things. So I feel blessed every day that I'm still here. And yeah, I'm on a different chemo now. He switched it when I restarted my chemo. He changed me to a different one, so I'm now on gemcitabine. But so far, it seems to be, my last scan showed slight shrinkage in the lymph nodes, so it's
really good to
well.
hear.
Yeah.
So obviously, as I keep saying, you're a real inspiration, both to the mesothelioma nurses, but certainly patients and carers that I am involved with that know you. What would you give, Sandra, for your 3 top tips, if you can narrow it down to 3, as to when you have a diagnosis? What would you say?
I think it's really hard to try and narrow it down to 3 things. There's been quite a few things that's been instrumental in me getting this far, I think. The first one was probably meeting you. I think it's so important to engage in a mesothelioma UK nurse. I think they're a brilliant source of a resource. So, they're good for looking up things, giving you advice, being there to comfort you. If things are not going well, I would advise everybody to find out who their meso UK nurse is. It's really important. They can point you in the right direction of where to go. Because even though I knew what meso was, and I was, okay with researching things myself, I've still found the help I've got from you and the support I've got from you invaluable. So I think that's the first thing. I think the second thing is make sure you find a consultant that is passionate about looking after meso patients. I wouldn't change my consultant now for anything. I hold him in such high esteem, and I know that he's going to do everything he can to keep me alive for as long as he can. And you need somebody like that. You need somebody who's passionate about mesothelioma. That is, into the research about it, is up to date, and that cares, and he does genuinely care. And like I say, I wouldn't change him for anything. The third thing is probably a joint thing. I would say stay positive. Decide at the onset of your diagnosis how you want things to go. Decide if you're a person who wants to look into things and find out more about it, question things that's being said to you. Some of us need that. Some of us need to have some kind of hope and not just all the negativity that comes with a terminal diagnosis. You need to have some hope, basically. Some people don't like that. Some people would prefer to just be advised and supported and pushed along to where they go. And if that suits you, that's fine. You need to do whatever it is that keeps your mind from exploding. Because believe me, being told you've got terminal cancer is catastrophic. And it's not something that, you want to be told. So I would say that. I think the other thing is joining the MAVS group, which is our Living Well group, was absolutely brilliant. I mean, I met you there. And I think that is so good in that not only do you get to be with other people that are in the same position as you, you get to meet the carers as well. And you see things from carers' point of view, because believe me, I can appreciate that I'm not easy to get on with some days. I have bad days. I mean, most of the time I try and stay upbeat, but I do have bad days. And when you have him on those bad days, you take it out on those closest to you. So seeing it from the carer's point of view is really good. The meetings are good in themselves in that we have speakers in, that give us different views on different things. We go out on outings. They're really good. I find, and this helps me because of the nurse in me, that a lot of the patients there kind of gravitate towards me. I think because they know I'm a nurse, but also because I'm one of them. Mm-hmm. So I think because of that, that helps me, because that makes me feel like I'm still wanted and that I'm still doing what I've been doing for the last 44 years. So that keeps me going, and like you said, I do have a lot of contact with a lot of people.
Yeah. That really good, useful tips. Thank you, Sandra. And I know there's so many things that you could talk about, and maybe we'll pursue that in another time. Just to point about your involvement in the Living Well group, I think that's, you know, it goes without saying, you're almost my wingman. So no, the nurse in you has never left. And quite often we're a bit of a double act, I think, sometimes in the Living Well meetings. And for anyone who hasn't attended the Living Well meetings, I'd say certainly try and get in touch via your local mesothelioma clinical nurse specialist. And if you're not aware of who your nurse specialist is, phone Mesothelioma UK, and they'll be able to put you in touch with somebody who'll be able to set you up and inform you of the local support groups. Sandra, thank you so much. You've very eloquently explained what you've been going through since 2017 and more recently, and I'm sure it resonates with a lot of people listening. Thank you so much for your time, and if it's not too early, I'd like to wish you a Merry Christmas.
Oh, same to you. Thank you.
Thank you very much, Sandra. Thank you. Bye bye.
Thank you. Bye.
Bye bye.
Bye.